Hello everyone. So very frequently asked question in clinical viva for undergraduates as well as postgraduates is related to a particular clinical test that we are going to discuss today. I'm sure you have heard of this test before. This is something which is called as book test, which is also what is called as Froment sign. Now, I'm sure you must be having this knowledge that it checks a nerve, that is ulnar nerve, and ulnar nerve is one of the major contributors to one thenar muscle, that is adductor pollicis. Now, what is the job of adductor pollicis? Let me just explain it to you. This is the job of adductor pollicis. So adductor pollicis has to, my right hand's adductor pollicis has to come like this and hold it like this. Similarly, the examiner, imagine if I'm the patient, now the examiner is also going to hold this with his adductor pollicis. Now the two will be trying to apply a pull in opposite directions, and imagine if the examiner takes this book away from the patient, then we will say that my patient's adductor pollicis is not working, my ulnar nerve is not working, my Froment sign is present, my book test is positive. So guys, this was introduction to a very important clinical test. Hello everyone, I'm Dr. Tushar Mehta and I will be discussing certain important clinical tests here related to ulnar nerve. So again, I've tried to show you here that when you perform a book test or a Froment sign, you're supposed to hold that book by using your adductor pollicis by trying to approximate your thumb with the index finger. So this is how you normally hold it. But now what I want you to understand is I will take you back towards that clinical picture again. So if I said, as I said, that if I will be able to, if I will be able to hold it, like this is the patient and this is the examiner. So as a patient, if I'm able to hold it like this, and if an examiner is able to hold it, and now they are trying to exert pull in different directions, but somehow I'm able to hold it, then I will say ulnar nerve is normal, book test is negative, Froment sign is absent. Now imagine my adductor pollicis is not working, which I've already explained it to you. If adductor pollicis is not working, ulnar nerve is not normal, then examiner can actually take it like this, and then we say book test is positive or Froment sign is present. But no, I'm not going to let it happen. I'm not going to let go of this book like this. So rather than holding the book like this, I repeat, rather than holding the book like this, what I will try to do is I will hold somewhere down the line, I will try to hold the book like this. Now when I will try to hold the book like this, so technically I'm going to grasp the book by flexing, please take a look, by flexing the interphalangeal joint of the thumb, and by flexing the distal interphalangeal joint of the index finger, which I'm sure you all are able to understand that flexion of this interphalangeal joint of the thumb is by flexor pollicis longus, supplied by anterior introitious nerve, a motor branch of median nerve. Again, this distal interphalangeal joint of index finger is flexed by flexor digitorum profundus. Of this side is particularly supplied by anterior introitious nerve, a motor branch of median nerve. So what we have understood today is that if at all my adductor pollicis is not working, my ulnar nerve is not working, my book test is positive, my Froment sign is present, I will not let go of the book and I will try to hold it with the help of my which nerve? Anterior introitious nerve, which is a motor branch of median nerve. So what we have understood is that if ulnar nerve is not working, it doesn't mean that we will let go of the things. We will still try to hold the things. So even if Froment is present, book test is positive, we'll still try to hold the thing by flexing the interphalangeal joint of the thumb by flexor pollicis longus. Now, this was about book test or Froment sign. This is about book test or Froment sign. Now please pay attention. On this side, the person is able to use the adductor pollicis supplied by ulnar nerve, but on this side it is not possible. Therefore, flexion of the interphalangeal joint of the thumb has happened, and that is why here we are using ulnar nerve. Here we are using anterior introitious nerve, which is a motor branch of median nerve. Are you able to understand this? So this is about Froment sign or book test. Now you can see this again. So flexor pollicis longus is working here. Now There is an image which is circulating on various social media platforms, and I've been asked a question about that same image. I'll show you the same image here. So I'm sure you all can appreciate in this image here that you have the flexion of the interphalangeal joint of the thumb. Can you see that? It's a very clear-cut picture where you have flexion of the interphalangeal joint of the thumb. Basically, you're using flexor pollicis longus, which is supplied by anterior intrusius nerve, a motor branch of median nerve. Now, along with that, I want you to see some sort of a hyperextension at the metacarpophalangeal joint of the same thumb. So I want you to see not only the flexion of the interphalangeal joint of the thumb by flexor pollicis longus, I want you to see the hyperextension at the metacarpophalangeal joint of the same thumb. By the way, that is what is called as Jeanne sign. That is what is called as Jeanne sign. Now, apart from that, my dear friends, please notice the atrophy or the wasting of the first dorsal introtia. Now, this is supplied by ulnar nerve. So that is why this is supplied by ulnar nerve. So that is why I'm trying to convince you here that you have an ulnar palsy. Yes. Because of which you're not able to this particular maneuver. Yes. But you can't let go of the things like that. Yes. That is why you're trying to hold the things by using the flexor pollicis longus, and you're hyperflexing the interphalangeal joint, but at the same time you're landing into hyperextension of the metacarpophalangeal joint called Jeanne sign. Yes. So this image is asked everywhere in the exam. This image shows ulnar nerve palsy. Because you have an ulnar nerve palsy, that is why this muscle is working, and that is why you have a compensatory hyperextension of the metacarpophalangeal joint called Jeanne sign. Now, what is this about? My dear friends, you have understood Jeanne sign, which is hyperextension at the metacarpophalangeal joint of the thumb. Now you will understand that there is something which is called as Bunnell sign. So this combined, I repeat, this combined hyperextension at the metacarpophalangeal joint plus hyperflexion at the interphalangeal joint, which is noticed when the patient tries to make a pinch with the thumb and index finger, is what is called as Bunnell sign. So alone, I repeat, alone hyperextension at metacarpophalangeal joint is what is called as Jeanne sign. But if you combine that with hyperflexion of the interphalangeal joint of the thumb, these two things combine together to make something which is called as Bunnell sign. I'm sure you can appreciate the O. So that is what is called as Bunnell sign. Now, when do you see this? When you have ulnar nerve palsy. Again, you can appreciate the dorsing, the wasting of the first dorsal intrusion. Now, this happens when you try to perform this movement, when you try to perform adduction. If you can't do that, then you do this. So basically, these things are seen where you have a palsy of which nerve? Ulnar nerve. But as a compensation, you are trying to use which nerve? Anterior introitious nerve, which is a motor branch of median nerve. I hope that makes some sense to you. So this image is now very well understood by all of us. There is wasting of the first dorsal intrusion. There is hyperextension at the metacarpophalangeal joint. There is flexion at the interphalangeal joint of the thumb. So that is what is called as Bunnell sign. This alone sign is called as Jeanne sign. And this whole thing is basically seen when you have a ulnar nerve palsy where you are trying to perform a book test or a Froment sign. Are you all able to understand this? So a couple of things are amalgamated together, they're accumulated together. So it started with ulnar nerve, it started with adductor pollicis, it started with book test or Froment sign. It started with a simple thing where two people are trying to just take the book away from each other. If one is not able to hold it, then he will try to hold it in this maneuver, and when you do this maneuver, you again land up into certain important questions which are usually asked in clinical exams. So you land up into Jeanne sign, you land up into Bunnell sign. We have given you the valid reason behind that. I would suggest you to go through this video again and try to make a logic out of it, and then only it will get imprinted into your head. So I'm Dr. Tushar Mehta, orthopedic surgeon, your faculty of orthopedics. Well, thank you so much. Looking forward to give you more videos on certain crucial topics. Thank you so much. Stay tuned. Bye-bye.